Well, I enjoyed every aspect of medicine when I was in medical school and as a junior doctor. And so I thought, being a rural generalist, I get to be involved in every aspect of medicine. And so when I was looking at becoming a rural generalist to start training, I got offered a position at Jamestown. And I accepted that position because Jamestown has a very good reputation for teaching junior doctors and students. And so for the past 30 years here, we've had medical students, first year medical students ranging up to fifth year students who are here for the whole year, interns, junior doctors, junior rural generalists. And so the practice here has a great experience and reputation in training doctors. And originally when we came here, me and my wife, we thought we'd stay here for 6 months, and we're still here 10 years later, just because I really love the job here. We get such a good variety of work, but also feel so welcomed by the community. We set up a really good training environment where everyone feels very supported, and we work very much as a team rather than individual doctors in consulting rooms. So there's always someone more senior available to help out if need be, and everyone is happy to provide colleagues support and advice, and everyone's happy to ask, feels comfortable asking for help when needed. So there's very few specialists based in the region, and so that means that there's great exposure for those doctors that want to be rural generalists, but also training doctors get to cover such a large variety of patient presentations, right from those that are pregnant, newborn babies, right up to the last days of life and palliative care, and also across the wide spectrum of medicine. So one day could be dealing at the roadside, dealing with an accident, then you're managing them in the hospital. In the afternoon you could be delivering a baby, the next day you could be cutting out skin cancers. So you get to cover all aspects of medicine, which I think provides a very good grounding for any doctor really, for any specialty. I think also in this particular region there's so much to do. We've got the beach nearby that's only an hour away from us here in Jamestown. The river's only an hour and a half away. Here we're only 2 hours to Wilpena Pound, or the main area of Flinders Ranges, where there's great hiking, camping, bike riding. The southern Flinders Ranges, so Melrose, is only an hour away, which has got great bike riding and cafes. Clare's an hour away with wineries. And then also the communities here are so welcoming, because there has been a doctor shortage over the past several years. You're not just one of many doctors in a town or hospital or region. You know, you're very, very valued and respected in the community. And you also get to work in a smaller team, so you really get to know your colleagues, such as nurses, allied health professionals, administration staff. You get to know them on a first name basis and really feel like you're working in a team. It's the best of both worlds. You get to work in a small community where you feel so valued as a doctor and get to manage such a wide variety of work, but at the same time help is never too far away. If you need assistance from doctors at other practices such as Port Pirie, Crystal Brook or Clare, they're only a phone call and less than an hour away. Also, if you need assistance from a retrieval service, the intensive care consultants can be up here within 90 minutes or so. So professionally wise, you get great responsibility to manage such a large spectrum of medicine, but at the same time you're very much supported with colleagues, not only in the practice but also in nearby towns. And then personally as well, there's so much to do in the region with outdoor activities nearby, wineries, cafes, and yet we're only 2.5 hours away from an international airport in Adelaide.